Good morning, everyone. Sorry, good morning, everyone. What a fantastic start. Okay, so what I'd like to do today is to talk about us as a global digital exemplar. And I did wonder, when James introduced the topic earlier, whether I ought to, as the fast show line is, I'll just get my coat, because I think he may have covered a number of things that we're going to talk about. But actually, there's a lot of similarity between what he talked about and actually what made Mersey Care successful in becoming a global digital exemplar. So, an important part of that is for the agenda for this. I want to talk about the context of Mersey Care, because that's really important in terms of our digital ambition. And although I'm going to talk about deliverables, I'm not going to do, a list of technology, because absolutely this is about behaviors and culture driving the technology we use, not just a list of technology that we've got, and hopefully that comes through. So, a little bit about Mersey Care, the footprint of Mersey Care. We have our local services. We have medium secure and high secure services covering a footprint much bigger than just this area, and it is characterized by increasing demand. So throughout Merseyside and through the other areas, Wales and the Northwest and the West Midlands, this typifies what we do. So in a very great sense, digital is not something that we would that is a nice to have. It is a must to have if we're to move at the required pace. So the other, as I move on to our strategy, the thing about Mersey Care, and we'd largely find that 95% of our contacts come from our local services, but this strategic wheel covers all of our services. And although it's not going to be covered today, I will mention that within our we're designing a new medium secure unit, and part of that is how we will digitally design that from the start with things like digital walls and virtual reality. Now that might sound really interesting, but it's for another day, but it's all part of what we do, because the important thing about our strategy for the digital is that when we developed our strategy 4 years ago, technology was at the center of what we did. Very much had board sight and was driven from our work. Another key element of the work that we do in mental health, and this is true of all mental health services, is that when we look at the design of services, we work side by side with our service users. And this again is about culture and technology. We don't build some field of dreams, and if we build it, they will come, or if we have an app, it'll be used, but very much working alongside our service users in the design of technology, as we would with buildings or with other services. So this backdrop then defines our digital ambition, and I guess also defines why we were successful in becoming a global digital exemplar. Interestingly, although some of it is around, we got a good digital maturity score, an important aspect of it was that we linked digital to the trust strategy, and also that we considered our population. So if the backdrop of this is that we have high levels of digital exclusion and the most vulnerable people, then we need to attend to that in our bid and not just say we will build technology. And I'll mention, and we mentioned the heat map before. Unfortunately, I have a statistic left that James didn't mention. But so within Liverpool, the heat map from the work that Martha Lane Fox did said that now there's about 16% of adults in Liverpool who have not used the internet for any retail or finance or other experience. 16% of adults. And if you take our cohort of service users, we don't know what that number is. We haven't done the work on it, but it will be much bigger than that. So we have to be conscious that we have a two-pronged approach, and this was part of our bid, is that we said it is as much about the people we serve, and about digital skills, and about digital workforce, if you like, and service users, as much as it is about the technology we produce. So the key things that we're doing, yes, to give quicker access to service, move control for people over their own health, and to think about sustainable recovery. Because again, unlike the acute trusts within mental health, of course, we're talking about conditions that will be managed over long periods of time. And we have, within our trust, a recovery college, which we call the Life Rooms. And out in the foyer, there's leaflets, and Megan is sitting behind a desk, happy to give information, talk to people about it. But the Life Rooms will be the basis around which we co-produce our digital technology. It is with and side by side with service users. So if we think about the if we think about what our value proposition is, the first element, this notion that we flip the clinic. Basically, this will help us. The notion of it is to extend the reach of our clinical systems and clinical information. But the ambition behind it is not just the management information and a new clinical information system. The ambition says that actually in some years, and I think outside even of the scope of the time frame for global digital exemplar, if we have service users who are using apps to track their health and well-being, then actually we'll start to may see and hope to see a drive where it is the service users who drive the model of, for example, the outpatient clinic. It is not an organizationally designed fixed place, you come here at this time. It has to be, that starts to be about how do we respond to need at the time that need arises. And really interesting what Jake said earlier. Not just on the day that you have the appointment, but at the time that it is required. So we think we term this flip the clinic. I don't think that helped us get the GDE, but it's quite a nice phrase. And also this people piece about digitization is about people, not just technology, co-production with and the digital skills, building digital skills for service users and for our workforce. And I guess I gave this presentation before, and somebody says, "Oh, but if you give people digital skills, it still doesn't give them technology." And I wonder about this. I know if you break a leg and you go into A&E, not to get into A&E, just break your leg, then you do go to A&E. But you come away with crutches, and then you get a fracture clinic to go to. So why not? Why are we not giving away devices if somebody doesn't have them, and connection to a broadband service, and then the equivalent of the fracture clinic, and then doing some training around digital skills? Now, we haven't started that, but we have to really think in terms of ambition about the 16% or the 20% of people who say, well, this is all great, but I haven't got a phone or access to the internet and so forth. So, who will benefit from the work that we do? Our clinical workforce, we expect to, and then also our clinicians themselves. We've started some work with a company called Otsuka, and Nick is here with us today from that company, to do some really interesting work around real-time decision-making that clinicians have as they're developing pathways, and we're doing a first initial evaluation of that this week. But also our service users and their families and their carers will benefit with online choice and access to specialist advice, and then in-time access to their clinical record. One of the really interesting kind of pilots of this is some work that South London and Maudsley did, and they built a product called Health Locker. And Health Locker gave people access to their records. But actually, you know, they didn't have throngs of people trying to get access to the health records. They've shifted that, the way they're designing it now, and then designing it around people maintaining their own health and well-being. And then as they maintain their own health and well-being, then to get access to clinical records, we really have to think it's not just about putting the technology in place, it's about enabling people to do those things that they choose to do. So we'll have that as part of our ambition, but it's not to build that particular field of dream. So the other place that will, or the other area where we'll see benefit is in wider health and social care. And one of the things that we will do as Mersey Care is there will be a process called Fast Followers, where every global digital exemplar has another trust who will learn from and share with some of the experiences. We haven't got our fast follower decided yet. I know for the acute trust, they're a little bit ahead of us in that respect. And actually, just talking to, is anyone here? Well, James is from NHS England. That's one person I can offend. The issue, and I'm sure it'll be recognised, it's much easier for NHS England to deal with the acute trusts and GDE and the fact that there's a proper digital maturity model and, okay? It's much harder in mental health. So we're at the start of something where we're actually helping NHS England to say, what would this look like for mental health? And then out of this, we'll also develop blueprints. The notion of the blueprint is, can what we do be shared so that others can learn from it? We very much hope so, but we also know that, and even in the short time that we've done this, we will also learn from others. I'm not sure how much time I have left. I'm okay. Time up. That's the problem. You go on fifth. However, I will stick to. What I'll talk about the deliverables, I'll just mention something very specific. We are doing clinical pathways, like you might expect. I'll just say, I'll pick the deliverable that I want to talk about, which is this. The work that we're doing, along with the Risk Authority in Stanford, around the work around the prevention and awareness of suicide, in order that we get to a point where those who are tracking their health and well-being will start to use machine learning, and we will use textual analysis, using a thing called Bayesian probability, that will intelligently inform in advance of an episode of either self-harm or suicide. And we're doing a lot of work around suicide. In the left-hand side as you go out, my colleague Jane Boland will talk about the work we've done in getting more than 80% of our staff through suicide awareness and so forth. So I will leave it. I'll leave it. This is all great stuff. I sound like Donald Trump. It's great. I'll leave it there, and just to say we're pleased to be a global digital exemplar, and thank you very much, and your forbearance for getting this far and listening. Thank you.